One of the main questions people have when they come in is, do you crack? And the answer is absolutely not. I do not crack. I am not one of those chiropractors that will crack your neck or pop your back or twist you into a pretzel or snatch your head off. And I'm definitely not one of those chiropractors, those showboat chiropractors that you find on YouTube that will wrap a towel around your head in full force and yank your head off and have a video of you in the corner crying. And then after that, I'm like, oh, I feel so much better. Those are very rare and unusual circumstances. I've been using Activator Chiropractic for many, many years now. It's a very effective way in treating the spine. The old-fashioned type of chiropractic, which is a very effective type of chiropractic, uses what we call manual adjustments. And I'm very good at that. That's when you would take someone's neck and you would crack it, and then you would take them on their side, and then you would crack their back. And those are very effective ways at making joints pop. I do not do that because Activator is much more specific and way more effective. The old-fashioned way of cracking the back is as it is said, it's very old-fashioned. It's very dramatic, and there's a lot of sound, and there's a lot of sounds that come out, and you feel like you've had a lot of relief immediately, but that's kind of a false pretense, because anytime you crack a joint, you're letting the gas out of the joint. You're releasing the gas in the joint, which allows the joint to move more freely temporarily. It is not permanent. And that's why when you've gone to a chiropractor and you get your back cracked or your neck cracked, it really does feel much better temporarily. And so the effectiveness of manual adjustments versus Activator is vast. With the Activator, I can have 4 specific settings on the Activator that I can use to treat different areas of your back. Not just your back. It can be a pelvis, it can be a hip, it can be an elbow, it can be a wrist, it can be a specific bone inside your wrist, it can be a carpal, it can be a metacarpal, it can be one of the tarsals in the feet. So the Activator instrument itself has had years and years of research, and it's very effective in treating the body from a holistic point of view. We can look at the whole body. We can even treat the TMJ. We can even treat the sinuses with the Activator based on the findings of the evaluation and the exam. So cracking chiropractic versus non-cracking chiropractic, when you get adjusted with the Activator, you're not going to get twisted. You're not going to get pulled or yanked. It's not going to be dramatic. If that's something that you want, then there are still many people that use the old-fashioned form of chiropractic. An analogy that I use is a word processor, and that may not even be the right word. You go to your computer, you type on the screen, and you press a button, and then a printer delivers the paper easily and effortlessly, and then you have a beautiful document that's delivered very easily or effortlessly. Or you can pull out the old typewriter, reel your paper in there, and start hitting the keys really hard, and there's a lot of action, and there's a lot of snapping and dinging and banging and movement and whatever. The end result is almost similar, but what was easier? The word processor or the Word document on your computer, to print that off is much easier. It's much less stress on the body. So the Activator chiropractic approach is a really great approach. We're not stretching ligaments. We're not twisting the back. We can treat people who have disc issues. If you were cracking someone and twisting someone, you would not be able to treat someone with disc issues. So the Activator approach is really a great approach to treating a multitude of conditions: the arms, the legs, the knees. You can even treat, like I said, the sinuses, the wrists. Any part of the body can be used. It can use the treatment from the Activator. The Activator has, again, I said 4 settings: 1, 2, 3, and 4, depending on the area that we're treating and depending on the intensity. Now, how Activator specifically works is this. In one of my videos, we talked about vitality, and vitality is movement. The reason chiropractic approach is so valuable and so important in someone's life is because we're finding joints that aren't moving properly, that have lost their alignment or have lost their mobility, and we're using movement, the old-fashioned way of cracking, you're putting movement in, or using movement through the activator to reintroduce movement and to reset that joint. And it's almost magic when that happens. If a joint has been static or its movement has been reduced, whether it's your low back, your neck, your elbow, the pelvis, the hip, when you can reintroduce movement specifically from a very specific angle, and that's the important thing with activator. When you're on the table, and I'm going to show you this right now, when you're on the table, it's not just a random pop inside a joint. It's very specific. When you're trained on how to use the activator, angles and the setting of the activator are so important depending on the joint that you're working on. So for example, if we are working on a low back joint, which is where two of the bones come together in the spine. Now the magic with the activator is I can specifically get into a joint, fourth lumbar, fifth lumbar, third lumbar, second lumbar, first lumbar, and angle specifically the activator in the direction of whatever joint I'm working on. It can be from the bottom to the top. If it needs decompression, it can be from the top to the bottom. If there is a side movement, I can come in from the side. If there's a sacral involvement, I angle and set the activator accordingly to where and how that joint needs to be adjusted, where the movement needs to be introduced the most effectively to get the bang for your buck for the treatment. And that goes from the bottom of the spine to the top of the spine, the top of the head, whether we're doing extremities. The activator is a really, really good approach to help balance out the body and get the most relief possible. Now, cracking and popping chiropractic, a lot of people still do it. It's impressive. There's a lot of movement, there's a lot of noise, and there is instant relief. One of the things with activator chiropractic is you may not get that instant relief that you may get if you get your neck. Someone takes your neck and they crack it. You may not get that instant relief, but the long-term effects are much better because we're not stretching the ligaments past their normal range of motion. We're not putting unnecessary force into an area that really doesn't need it, or too much force into an area. We gradually treat the spine, and then over time, that relief occurs, and it's much more long-term. So I'll bring the patient back up. The difference, again, is old-fashioned versus new. And some people still prefer the old-fashioned chiropractic. If someone is nervous going to a chiropractor because they don't want to get cracked or they don't want to get popped, activator, my approach is the solution to many people's problems. A lot of times people that have been nervous about coming to a chiropractor because they didn't want to get cracked and they've been referred to me, and someone comes in and they're like, I'm really scared, I don't want to get cracked or popped, and they're really tense, and I get them on the table and I show them. One of the things I do is I say, show me your thumb, and I say, this is as much as you're going to feel, and I set it on the highest setting. This is as much as you're going to feel. And their answer is always, oh, that's it? And then I get them on the table and I treat them. I never treat them on a level 4 the first time. I usually do a level 1, and they get off the table and they're almost a little bit disappointed. They're like, that's it? I thought it would be so much more. No, it's a very easy and effective way to treat the body, because the adjustments that need to be made are not gross adjustments. They're just fine adjustments. When a joint isn't tracking properly, and you address it appropriately with whatever level, then that function can return to the joint and the vitality can come back